We're going to get started here. Welcome to Psychiatry Grand Rounds. Today I have the pleasure of introducing Dr. Larry Oñate. Dr. Oñate is a jack of all trades. He has done many different things in the community. Let me just tell you a little bit about he did his internship at University of California, San Francisco. He did his residency here at the University of Arizona, and then he did a child and adolescent residency for a year here as well. And since then, Dr. Oñate has been, he's supervised residents here, he supervised me. I'm probably not the most successful outcome of all of his supervision years, but he has many other greater people to talk about than me. But he most recently, he served as the medical director at SAMHAC for a number of years, and is now currently working as one of the psychiatrists at Cottonwood. In addition to that, he has a private practice where he sees patients and has had private practice since 1993. One of his roles in the past was he worked as the psychiatrist who did he was the house staff psychiatrist for the University of Arizona here. He did that for a number of years. And so he has a very keen understanding of the kinds of stresses and issues that residents have to deal with during their training. And fortunately for us, he was willing to come and talk to us about it today. His title is Physician Wellness, and Work Overload, Burnout, and Empathy, How to Maintain Work-Life Balance in Psychiatric Practice. And he has nothing to disclose, no affiliations. We are very fortunate to have him, so please give him a warm welcome. Thank you very much.
Thank you, Dr. Heron. I still have my memories of supervising Steve. He actually had a really nice office at the time. I remember that. He really did. It had windows and everything. Just a quick addition to my background. I was here 12 years and really worked with the Chief of Staff Office to develop the Physician and Wellness program that we have here, and did that for 12 years. And I saw patients, physicians in my private practice back then as well as now. And so I kind of fell into that role. I took the job as the house staff counselor, and then after I took it, found out that, along with that came the Physician Wellbeing Committee for UMC. So I started doing that, and I ended up liking it a lot and was very proud of the work that we did there, in the program that we developed. The talks that I used to have to give for the university were rather generic, and this year I was a little excited about being able to focus a little bit more specifically on psychiatry. When I supervised the residents, I did talk to him about some of the unique things that psychiatry brings to medicine, and the difference in how we have to take care of ourselves. And so I want to touch on some of that today. I'll go through that. We're going to be looking at some different things. We want to specifically be looking at job stress, and wanted to bring in this year burnout. There's been, over the last several years, quite a number of mental health care professionals that have really suffered some of the consequences of stress and burnout. So I really wanted to look at that and address that. Want to really look at kind of, from a health standpoint, balancing work and work demands and work hours, that type of stuff, and how we go about looking at that and trying to balance that as a goal of therapy. I think the other unique thing for us is, us being the tools that we use to work with our patients, is how when we are unhealthy and out of balance, it affects the patients that we see. And we want to take a look at that. One of my main roles here when I was house staff counselor was in really looking at how the house staff performed and the attendings performed. And so job performance was a really important indicator of wellness that we followed. I think this is directed a little bit more to residents, these objectives, but we really want to look at how we can increase coping skills during residency and coping skills in order to deal with stress and manage that. Want to look at productivity, efficiency and performance, job satisfaction. One of the big things I learned in my role was just kind of how reframing can really impact a person's appreciation of their job and their satisfaction from it. So we'll talk a little bit about that. And basically wanting to improve overall health, and with some of the physician studies, really increase supportive relationships for the residents. I've done this for 12 years. I've been keeping track of some data that I found interesting, and I'd like to ask you to just think about a question for a minute and then write down the answer to that, and that is what the most significant source of stress is for you. And this source of stress can be either a positive, neutral, or negative type stress. You should have a little 3x5 card, if you wouldn't mind writing that down on one side of it for me. So this would be the most significant source of stress. Now, one of the things that has been interesting with this exercise over the years has been the fact that it really hasn't changed much, even with the change in healthcare, changes in economy, that type of stuff. So a lot of this is kind of built-in stress for physicians. Okay. I think one of the most important things that we learned when we had an on-site house staff counselor was some of the personal characteristics that really helped a person get through a residency in a healthy way, and some of the personal characteristics that that cause some problems for residents. And there are a couple of things we looked at, and self-esteem was one of them, and anxiety was the other. The residents that had a good self-esteem and a low anxiety level tended to do very well and perform very well, and this is consistent with a lot of the performance literature that spans into sports psychology and performance in sports. Just the sense of confidence and not wasting energy and being unable to focus by having a lot of anxiety really was very important in that. And this really did play out very remarkably with the residents. So needless to say, we really did want to treat aggressively anxiety in residents. It really wreaked havoc if they had it. And the opposite was true in terms of good performance. Low self-esteem and high anxiety levels really were indicators of residents who tended to struggle a little bit more and not perform as well. And any thoughts? Do you all have any thoughts about why that might be true? Any thoughts about anxiety? Okay, I'll answer that for you. One of the things that that we looked at was time management. I think when people get really stressed, professionals, and you have a lot to do, there's always the tendency to go to being able to really structure your time and use time management as the tool to help you perform. And that worked for a lot of people, but it didn't work for everyone, and especially people with any kind of anxiety. And the real critical factor ended up being the energy that people had. People performed more efficiently and did a better job if they had the energy to do so. So the mental energy, emotional energy, physical energy, and they just did a lot better. And so one of the things, and you'll see this in practice, is that anxiety is very, very energy wasting for people, and it's not a good drain to have when you want to be performing well. And so that's one of the things we looked at. Self-esteem, I think that goes without question, but the anxiety is really something that you want to consider and really take a look at. We looked at an individual at 3 different levels. One is just at a cellular level, how well physically a resident was. The second level was just personally, what their character was, how they developed handling stress, learning how to handle it and all. But another really important factor became just the system and the organization that residents were working in. And this is very true of physicians or attendings as well. And so the organizational environment became a very important factor. There's clear indication that there are healthy work environments and there are unhealthy work environments. And the strange thing about that is that it's so easy to correct some of the unhealthy things to make work environments healthier and more productive. It's amazing why people don't do it more, but it's very simple. And healthy environments are environments where tasks are very clear and priorities are very well known, where goals are clear and they're important. They match the individual's interests. So, for example, an example of that would be, when you have residents who are very interested in doing a good job and having good patient outcomes, and a program that has that same goal and priority, and that makes it a really good match, and people tend to do really well. And so a simple thing with that is you really try hard to choose people that fit those matches, and that's an example of that. Goals is a very important one. People's goals have to match. They have to be very clear on what the goals are that they're supposed to be doing and the importance of them. For more at the attending level, the jobs, the environments that had the potential for advancement or to learn new skills, advance your learning, were a lot healthier. And probably the most important one, as times change, as things just change in the world around us, an organization that is responsive to the needs and values of the people that work there became very important. Over the years, I think the most significant stress for residents had been relationship and family issues. And it really took a while for residents to balance being a human being with a life and family with being a physician and being a professional, and how to be able to maneuver back and forth between the two of those roles. And so that was always one of the primary reasons for residents seeking help. Other issues, another significant one was financial and loan issues. At the time of graduation, a lot of times it was employment and fellowship issues, and then many times, unfortunately, during treatment, it was single parenting child custody issues. Usually internship year, we dealt a lot with death and loss issues. When residents haven't experienced death and loss themselves, it was very hard for them to use any kind of a framework for dealing with death and loss when their patients died. And so that was another thing that we dealt with. People who are the age of residents deal a lot with loneliness and isolation, and that came up a lot at the time that the physician well-being committees were being developed. Emotional control was a big issue. Before, physicians used to be able to rant and rave and scream and throw things, and it wasn't too much of an issue, and now that's definitely behavior that's unacceptable now. And then just the performance issues of training exams and board exams. So this is an example of a life balance wheel, and this is, a life balance wheel that all the parameters and roles are balanced and equal. It's an ideal. This would be one that is probably healthy for most Americans and certainly physicians, where work is going to take a big chunk out of it, but you still have some balance in the remaining parts of it. And this is usually what I got to see and what I still see, and it's really where a lot of times work is really imbalanced. And some of that is because people choose to really spend that time and focus on work and do it, and other times it's because they have underlying symptoms and illness where they can't be efficient and focused and perform well, that requires them to take longer to do work. And these are the ones that we really want to be catching. I'm going to go ahead and skip this case here. The sources of stress in work, I just want to kind of paint a picture of how we compare to other disciplines, other people, and then maybe also looking at other countries and physicians in other countries, because we really do have a skewed view of work and performance and balance in life here in the United States. But the sources of stress in the U.S., the top one is finances, health is another one, work, childcare, family, and marriage relationships. One of the things that we've looked at, or that studies have looked at, is what people need in order to do their job and do it in a healthy fashion, and whether those entities meet up or not. And I think that's what we're finding is a lot of the issue with job stress right now is that there's a lot of work to be done and not enough manpower to do it, or there's an attempt to try to not meet that manpower, and that creates that imbalance that people often feel. The role demands conflict with role demands in other life domains. You see this a lot with people who have children now and divorce or just have children. I just saw a person in my practice who did, her job required that she do shift work, and that was very difficult for her to be parenting and have that type of job. And I think an example of when you look at these kinds of issues and how you approach it is that, her approach was kind of trying to have work kind of change for her so that it would fit her life a little bit better. And it was a government job, so that probably wasn't going to happen. So, a lot of what we wanted to do was kind of reframe that for her, and her realizing that this was a really important part of her life and a real big source of stress, that she did have the ability to choose other kinds of jobs within the company she worked with, or even going outside of that. And she had some good skills and some good work history and all. And so that's just it's kind of amazing that she wouldn't be able to conclude that on her own, but that was very helpful to her to be able to process that and kind of get to that point. One of the things that we look at for physicians is and one of the issues with physicians in terms of performing at work is that sometimes we don't realize that physicians are struggling because they protect their work environment and let everything else around them fall apart. And so sometimes we really don't get a clue that they're really struggling at work because they really put all their time and energy into work. This is a couple of studies that are just looking at work stress in America, and these are different kinds of groups that they looked at, and I just wanted to show this in terms of looking at the percentages, and just I think it's pretty remarkable that there's a real significant part of the population that really is really struggling with work stress right now, and just want to point that fact out. A quarter of employees from some of these studies were viewing job as a #1 life stressor. 3/4 believe that work was more stressful than a generation ago, and half of employees reported working 12-hour days and skipping lunch because of job stress and demands. 12% reported calling in sick due to job stress. A couple of interesting statistics is the cost to companies regarding job stress, and you see this a lot with mental illness, and the same kind of statistics really cross and just cross over to healthy people who are working, but really working under a lot of stress, and $150 billion per year lost in productivity and disability claims. 50% greater in workers with high job stress. That would include physicians and other professionals, and problems at work more strongly associated with health complaints and other life stressors. So it's a significant problem out there, and a remarkable problem. The average work week now is 47 hours. This isn't from a physician study. 20% of work hours are 49 hours per week, and it's increased about 8% in the past generation. From 90 to 2000, we've increased by an extra week per year of work, and Americans compared to other countries, compared to the Japanese, we work a month more per year and 3 months more per year compared to Germans. This was a ComSite Corporation survey. 55% of workers had high levels of stress with extreme fatigue. Again, looking at energy as an indicator for stress and performance, and feeling out of control. 42% had constant but manageable stress. Top 3 work stressors were people issues, workload, and work-life balance. Okay. What happens when people at work are stressed? And I think for me, and what we looked at with the Physician Wellbeing Committee was that there really is, it translates directly into a decrease in productivity and performance, and that's just something I think to really be aware of. As a professional with a license, you want to be aware of that, because if you start noticing some of the indicators in yourself, I think it's really important to always translate that into the potential for not doing as well as you can with patients, and thus having not the outcomes that you want to really strive for and have. So to me, that's like one of the most important points, is that self-monitoring, self-awareness of your stress tolerance and your stress levels, and kind of how that relates to the work that you do. We see this a lot out in the community, especially in public health, the increased workforce turnover, higher rates of absenteeism. With residents, we saw it a lot with motor vehicle accidents and other types of accidents. it's real clear with the morale in different places, interpersonal conflict at work, physical and psychological health problems. The cost to the employee, the cost to the resident physician, distress and suffering, illness, inability to work, instability, which is an important thing for us in healthcare, low self-esteem, and loss of identity. Okay. One of the things that I think that we see a lot more in physicians and is the ability to work autonomously, and that's a big issue, and that's tied in a lot more with the way people experience stress and what it does to a physician or a psychiatrist, and that's another thing that we would want to look at. Burnout is often described by patients, physicians, as an emotional fatigue, just being detached from work, cynicism. Often, for some people, it's a lot of sarcasm, both with patients and other people around them. The inability to appreciate the good that you're doing and the work that you're doing when it's there. And then just really a loss of your satisfaction with work. I want to point out the emotional fatigue, again, just keeping in mind from an energy standpoint when people just don't feel that emotional energy. For psychiatry, I think that's a real critical indicator. So I think psychiatry, more than a lot of other disciplines, really does use emotional energy, mental energy to work in the field that we do, and to deal with patients and to deal in a healthy way with them. For physicians that I've dealt with that have run into problems and sometimes legal problems, when that emotional energy drops, they don't care as much, that's when problems happen. That's when boundary violations happen. That's when poor decisions happen. And when they're healthy and well and they have that energy to really think through things, they're less likely to do that, and they don't. That's not the time that they make errors like that. And so for residents now and medical students, I think that's really important to start kind of tracking that with yourself and being aware of that. And when you start feeling that emotional energy dropping, that mental energy dropping, and what we've often called purposeful energy, and that's just that desire to get up and go to work and feel like you're doing a good job with your career and what you're doing, that you really want to stop, take a step back, and start looking at that and analyzing that. If it's an underlying issue like depression or anxiety, get that fixed as quickly as possible. If it's other things in terms of relationships, direction in your life, those kinds of things, get in with somebody to help kind of figure those things out and work them through. Okay, these are some of the symptoms of burnout. I think for the most part, people are aware of them. Irritability is a really big one. You find people who are normally pretty easygoing and pleasant to be around, starting to get upset about little things and irritable with everything. Fatigue, sleep disturbance, concentration issues, performance, things that kind of, when I was here at the university, a lot of the referrals I got were from residency directors who would always refer patients and just say, this was a really good resident, they're not performing the same, I don't know what's going on, take a look and see what's going on. So for some people it becomes real obvious that performance level does change when people are struggling. in that way. And that's a real good thing to kind of keep an eye on and track. Absenteeism, even creativity. I think in psychiatry we need a lot of that mental energy, emotional energy, because we don't have studies or labs or other things that give us a diagnosis. I mean, we really have to take a lot of cues from our patients, listen to what they say, be very present with them to be able to make diagnoses and figure out what's going on with them and what they're saying. And then you have to kind of be creative in order to kind of figure out how you're going to be dealing with those problems and those issues. So I think we really, as psychiatrists, really need to be probably, a lot more aware and in tune with this issue than other areas of medicine. Okay. The other couple of other issues I wanted to just point out on this slide were some of the psychiatric illness type things like depression and anxiety. Marital issues for physicians. One of the biggest sources of health and wellness for physicians was relationships, and good relationships really help physicians, and relationships that weren't healthy really impaired physician performance. So looking at just relationships around a physician resident, and then really I think we don't like to talk about it a whole lot, but the substance abuse and misuse issues that we really want to be keeping an eye on and making sure that people are not struggling with that. Some of the risk factors for burnout, just systems and organizations, cultures that don't allow a person to say what they really want and what they really want to do, and require a person to work when they have other important things going on, and really discourages saying no. A lot of the places that I've worked where I feel that they've been healthy have been places that allow, for physicians at least, physicians to really work their schedule. And what I found is that when that happens, people are a lot more willing to cover each other, and really you don't run into very many problems that way, because the positive is that you really get to balance your life a lot easier. So when that happens, it's a lot easier to be inconvenienced on a one-time basis or so to help somebody else out. And that's really been true. Steve mentioned earlier, I left SAMHIC very recently, and I was there 10 years, and that was really a lot of the culture that we had there. And I never really had, as medical director, a lot of problems with coverage. If somebody was sick suddenly, if they had to leave suddenly, people just stepped in and covered. And now with some of the systems changing from the state, that part has been really taken out, and now there's a lot more difficulty with coverage. And so I really have found that to be a really, really important thing. And that really goes back to people being able to live their life and really balance it out. For residents, you saw that a lot where, there was residents who wanted a lot of time off but never really wanted to kick in and pitch in and cover for the other residents when they wanted off. So, that's one of the things I talked to the residents about in the beginning of the year when I'd meet with the individual programs is, that first year, that internship year, that group that's going to go along for 3, 4, 5 years, that's the time to really start creating that culture of, we're individuals, but we're in this together, and we need to try and make it a healthy kind of collective group together, so that when somebody's struggling, we all pitch in and help out. And and everyone benefits from that. Another big factor is the ability to participate in decision making, and you know, but what I mean by this is decisions that really affect, you know, the work that you're going to be doing directly, not whether, you know, the company adds a garage for, you know, for employees or that kind of stuff. It's you know, what you need to do your immediate job, the schedules you need, you know, the equipment, that type of stuff. And then expectations, again, going back to the healthy environment, you know, it's really hard to feel you're doing a good job and do a good job if you're not really clear what the expectations are for that job. Responsibility, you know, some people have certain skills and are really good at them, and others don't, and that will be another thing that we'll see a little bit later, is the in terms of healthy environments, is to really be able to see and utilize people's individual skills so that it all kind of comes together and fits in a nice kind of puzzle. It's really hard to make somebody be someone or do something that they're not really wanting to do or they're not going to do, especially if there's somebody there that really, you know, has those skills to be able to do that. The communication of the organization, that's really important. You know, even the bad news, people tend to do a lot better if they hear the bad news, but, you know that people are taking care of it, and that's not something they're going to have to worry about. Dysfunctional and interpersonal dynamics, and lack of workplace social support. Here we're looking at mismatch in values. I've seen a lot of problems arise from this. You know, in healthcare settings, I think that when you have a good team and want good outcomes, that there has to be some real good matches and alignment in people's attitudes and belief systems for getting that done. Let's see. Job security or insecurity and lack of career growth. You know, that's another one that over time really adds away. And then another one that I want to point out is the obsessive kind of compulsive personality traits. They're really, in medicine we see that a lot, and they're really good in a lot of ways. But in a work setting where there's a lot of other people around, sometimes that can be very, very problematic and very destructive. What are some of the consequences of burnout? Decreased capacity to regulate a person's reaction to stress, acting out. Acting out sometimes might mean saying inappropriate things to patients, losing empathy with patients. For supervisors, it might be losing objectivity, being overprotective of certain people, and harsh and punitive as well. For employees, it's where you see fewer positive behaviors and more negative behaviors. So I think the good things about being in the medical profession, and in particular in psychiatry, is that it really is a rewarding profession, and it really has a lot of benefits. It's a demanding profession, I think, in many cases more than other professions, but it has a lot of stressors. And I'll point out at this time that, you know, when I've spoken with people coming out of training, that type of stuff, you know, I really believe that for us, it's very difficult for us to work, you know, more than 40 hours, more than 45 hours, and be healthy and provide good care. And a lot of that has to do with what we do in our work, you know, what we have to give of ourselves, and the energy that we have to maintain to be able to work and really diagnose, pick up things, and treat patients. It's just a career that I think limits us with a lot of those. I personally have dealt with it in some different ways. I don't see patients 45 hours a week. I have other types of business in medicine that I balance that out with, and that's how I've kind of made it work for me. But I think that it definitely is a career that we really have to look at the amount of time that we put in, and the need for recovery that we have in this profession. Examples of that are relationships that you see in medicine, and in particular in psychiatry, where people go home drained from working all day long, and then don't have that energy for their significant others and their children or their friends around them. And so those are the things that you really want to be aware of and you want to look at. You know, I know what my cutoff is for the number of hours to work. Everyone's going to have different abilities that way. And I know a lot of colleagues that think they have the ability to work 50, 60 hours, but if you really look at outcomes, I wouldn't necessarily say that that's the best thing for them to be doing. And so you really do want to look at what your abilities are going to be for that, and figure that out for yourself, and be creative with how you can, if you need to earn more money or you just like working, you know, that's great, but you might need to do other kinds of jobs, other types of jobs with that. There is a lot of growing frustration amongst physicians out in the private practice. You see that a lot now with nurse practitioners and other, even primary cares. There's some articles coming out now in primary care and psychiatry, just, you know, the competition that's coming out with that. Looking at autonomy and how important that is to physicians, and especially I think in psychiatry, I think that autonomy is important. Like for myself, that I know what my limitations are going to be, and I need to be able to work within the realm of that, since I know myself and what I need, and to be able to fit whatever jobs I have so that they match that way. And that's, you know, I feel like I've been able to do that, and I feel very lucky I've been able to do that, and it's worked really well that way. Physicians generally have high expectations of themselves and others, and you know, this was something we saw a lot with relationships. You know, with residents and physicians, they take these recovery periods, which are healthy and we're supposed to do, but they would get frustrated because their child had to stop every 15, 20 minutes. The child's 2 years old. That's what they do. And so, you know, there's really a lot of the framing that I did with that type of situation was really looking at where those high expectations need to be and then where they don't need to be. And if you look at a lot of the performance literature, you know, perfectionism works, and it's really good when you have a lot of the variables that you can control. And when you have variables that you don't have control over, that's when it really is pathological for a person. And so, you know, those are the kinds of things that you really want to look at. So high expectations of others, examples of that might be, you know, having a resident kind of think a significant other is lazy because they're only working 40 hours a week. They should be going to grad school, and they should be, and those, I think one of the things that happens in medicine that we don't really become aware of, but it really does change just some basic ways of being and functioning. And I'll give you an example of that. Something I have to remind myself a lot about is, constantly actually, is, you know, taking time to drink, you know, just drink water, taking time to go to the restroom when I have to go, taking time to eat when it's, you know, I've been trained to kind of not do that, and some of the positive benefit of it was that I'd get out early and be able to make my kids' games and do all that kind of stuff. But the real bad side about it is that, you know, I didn't perform as well when I didn't do that. And so, but that's kind of how I think and how I was made up, and that all comes from my training. I never did that before I went to medicine, and you know, that was a consequence of how I came out. But to this day, I still have to remind myself, if I'm feeling thirsty, I have to remind myself I need to take a drink. If I feel the urge to use the restroom, I have to remind myself, you need to go use the restroom, you know. Instead, it's a very conscious thing that I have to do. And the same for eating. You know, I get hungry, but you know, sometimes you think it's just easier to finish one last thing or to make a phone call or whatever. And this is the stuff I used to tell residents to do. It's just part of how we're trained, and we have to just kind of work with that and remind ourselves. So I talk a lot about being bicultural in medicine, the way that we listen to our family and significant others, the way we talk to them, the perfectionism that we expect. It's all very different. It all works in medicine. It's appropriate here. It's good here. But once we cross the line to going home and make those transitions, it's a whole different world. Even popping in the Circle K and dealing with the clerk or whatever, you know, that's really the real world. And sometimes we have to really transition into that and be real aware of that and cognizant of it. A lot of problems with limit setting sometimes with physicians. Again, as I just mentioned, that reinforcement of service before self, taking care of others before yourself, chronic self-neglect and pursuit of work, and I'll go on to this. For psychiatry, when we get low on our mental energy, where we process, we can over-identify with patients. We can let our anger and dislike of patients come out a little bit stronger. We can certainly lack empathy for patients. We can feel maybe a little more incompetent, a little less self-assured, and then I think really needing to be aware of when you're doing therapy with patients is making sure you don't cross any boundaries and make any violations of that. So the good news is about preventing burnout, and instead of having to recognize it and deal with it. And there are a lot of things that you can do to do that, and it's an active process, but it's certainly something that you can do. Promoting personal and professional well-being, managing your physical, emotional, mental, and spiritual wellness, monitoring your productivity and performance, looking at your interactions, your relationships with other physicians, other healthcare staff, risk management issues, patient satisfactions, and then, of course, making sure that you have good patient outcomes and patient safety. There are some organizational actions that can be put into place, and just, having organizations or systems recognize the importance of each individual as it contributes to this team of healthcare, because the work that we do is actually really, really important. Sometimes we don't see it that way, but it's important in terms of that, sometimes we're really dealing with patients' lives and can really impact that. So having organizations reward good performance, be aware of that, set the tone, set the culture for that, allowing opportunities for people to learn new things, develop new careers. Important that organizations really value their individual workers and that work that they contribute to the team. Having policies and actions that are consistent with the organizational values, that's something that always you fall back on. That's where everything starts and where it comes down to. And companies that really have great policies and things in writing about their organization, but they really don't follow them, those are really the unhealthy ones. All of that, visions and all that really should be owned by employees and people who are working in the company, and they should be lived by it, and that's when you really get the healthy environments. Let's see. Individually, what you can do is make sure that you influence your own happiness through the choices that you make. And this is, I think, what is the most important for the younger people in the field, the residents, medical students, is really, you're going to know what your skill levels are, what you're good at, what skills you have, and all that. But also, as you go along, really look at things and know what your limitations are as a psychiatrist, what you need in order to live healthy, the balance that you need. It's hard in this field, I think, to ask for help, but that's a real healthy thing to do and something that we really need to promote. That recovery and performance, so that you're always healthy in terms of that energy level, requires that you have recovery periods. You look at stress. I didn't bring those slides, but those are the slides I used to cover in the lectures before. But just the physiology of stress and what neurohormones they release, and what actions those neurohormones cause. And one of the things that becomes very important in that is that stress response was not designed to be turned on all the time. It's designed to be turned on and off, turned on and off. And so sometimes you have to artificially do that, be able to turn it off, and that's that recovery period and the ability to recover. Everyone experiences that recovery differently, so you have to figure out what works for you the best, what you get most of the bang for your money out. For me, it's beaches. So that's something that I try to do, is get to a beach that's, I can automatically kind of go into relaxation mode without very much effort. And really having supportive relationships at home and at work. And I think in terms of, for younger people, if you notice somebody that is more like a mentor, and you see that they have that balance in life that you think fits the way that you perceive yourself, that you want to try and capture some of that. Ask how they do it. How they balance their life, what their life's like. It's kind of personal, but I think most of the time, in training, that's all part of training, and it's very important for you guys to know that and learn that. So, I think within reason, you can ask some of those questions. So, setting limits at work and with work, I think a lot of times we have to know when we're at our limit, and we need to express that to others around us. Avoid sacrificing personal time, especially sleep and recovery periods, and your time with others, and finding what I think is most important, that meaning and purpose in work. So burnout with physicians always is described as, I wake up in the morning and my first thought is, I have to go to work. And so what we want is the opposite. When your eyes open in the morning, is for your first thought to be, what's your purpose for that day? And you know, be happy about it, be enthusiastic, be excited about getting up and starting your day. And for residents, you have to really kind of force that. You have to kind of use a behavioral technique to get that going. But you want to really try that, okay? And then finding things that recharge your energy and battery. In terms of that perfectionism, what I've always done with physicians and residents, and the surgeons are usually the ones that we did this a lot, was, you know, with perfectionism, you know, you have to, and in psychiatry, we did this a lot with psychiatry residents, is kind of really cognitively going through a process of asking yourself, what are the absolute things that I cannot allow to happen or that I have to do? And then what are the things that I will have to be okay with not being perfect with? And so I think in psychiatry, you know, you can think about that. There's some pretty obvious ones. In surgery, there were some pretty obvious ones. You know, the things that the surgeon had less control over, for example, a diabetic person in their healing process, they're going to have to let that go a little bit more, you know. As long as their technique was good, infections were, I mean, that was how they were going to rank their priorities. And for psychiatry, you can do the same thing. And so, you know, suicidality, homicidal stuff, psychotic stuff, I mean, things that we should be able to pick up, that we have to try our hardest to pick up, you know, those are the things that we want to really focus our time and energy, you know. And there's things that will be less important. They'll have less of a consequence. So those we can let go a little bit more. If I can just real quickly, I know we're a little bit over time, but just ask you to take a few minutes and write down what your most significant source of energy expenditure is and how you recover. So this would be kind of, you know, what drains your energy or what gives you more energy, and what you use to kind of replenish your energy, your emotional, mental, purposeful,